This is All India Radio. In the program Spotlight, now we bring you a discussion on precautionary measures to tackle the health effects of heat wave. The participants are Dr. Piyush Ranjan, Professor of Medicine at AIIMS, New Delhi, and Dr. Atul Kumar Tiwari from All India Radio.
Hello, Namaskar and welcome to this edition of Spotlight. Today we have with us Dr. Piyush Ranjan, Professor, All India Institute of Medical Sciences, New Delhi. Dr. Sahab, you see the heat wave conditions are around.
Yeah.
We are in the month of April and the Met Office has predicted that this heat wave will continue for next 3-4 days. And the bore of the brunt will be borne by the people in eastern India, northwestern parts of the country, and even to the extent of reaching out to Sikkim. So the weather is heating up, temperatures are shooting up, and the people are looking out for some respite. They have a lot of questions in their mind as to how to deal with the health effects of heat stroke.
Well, it is a golden line in medical therapeutics that is prevention is always better than cure. And for dealing with heat stroke and related complication, it is very important for all of us to accept the fact that we have to prevent it. And the ways to prevent ourselves from heat stroke related complication are very simple, and they are: number one, try to avoid going in sunlight so far as much as it is possible, especially the people who are in the extremes of age. The younger one below the age of 5 and the elder one are senior citizens. Number two, if you have to go mandatorily during noon time outside in sun, then it is very important for you to keep yourself adequately covered with full arm length sleeve shirt and hat and the turban. These are very useful in preventing yourself from the direct sunlight. Number three, keep yourself adequately hydrated. So prevent yourself from dehydration is important. For that, the golden rule is whenever you are going out and you are expecting that you have to be in sunlight for say half an hour or so, then take at least 1 liter of oral rehydration solution.
Dr. Sahab, you spoke about keeping yourself hydrated. When we say that one has to keep oneself hydrated while going out, what does it really mean?
Two related terms. One is dehydration and second one is rehydration. Dehydration means clinical condition in which there is loss of water and salt in our body. Rehydration is the replenishing of the normal salt and water when someone has suffered dehydration. In dehydration, the usual sign is that people feel extremely thirsty and the amount of urine that one usually passes is decreased.
You spoke about dehydration. There are people who want to know what is the difference between a simple dehydration or a heat stroke. What is the scale of severity on which we can measure them?
Heat stroke is a larger umbrella in which that has got different stages based on the severity. The earliest sign is the dehydration, the signs of dehydration. The signs of dehydration could be extreme thirst and number two, decrease in the urine output. And if the complication is going a bit more severe, then one can have headache, one can have vomiting, one can have diarrhea, one can have fever also. And if the severity rises further, then one can have even what we see that altered mentation. So altered mentation means the general behavior of person will change, the level of consciousness will change, and in extreme cases people may go even comatose.
So these are really worrying signs, and should the patient go to the doctor when he comes across these symptoms?
If you are having simple symptoms like extreme of thirst, decrease in urine output, then you should actually try to rehydrate yourself in the home. But if you have developed fever, diarrhea or vomiting, extreme of these complaints or altered mentation, and you are feeling that you are getting drowsy, then you should definitely take your help and suggestion of nearby doctor.
A major question which has been asked by the people that in a state of dehydration, what should they eat or what drink they should take, and especially whether they should rely more on home-based preparations or they should take recourse to some vintage thing which they can get from the market.
So the best rehydration solution is the oral rehydration solution, is the electrolyte powder that is available everywhere. It has the right proportion of the designated minerals, especially sodium, chloride, sugar and water, if prepared as per the regulation that is mentioned over there, number one. Number two, it is important to note that the plain water by itself is not the ideal component because it is having water only, it is not having the salt. The third one is that apart from this, you can take the other commonly available fluids in your house like dal pani. You can also take shikanji. You can also take sarbat. So these are the common remedial things that you can take from your household and day-to-day things.
Questions have also been raised about the use of antibiotics during diarrhea following heat stroke or dehydration. Is it really required to have antibiotics in such a situation?
No, not at all. Antibiotics are required only. They are beneficial when you are having infection because of bacteria. So in lot of viral illnesses and there can be n number of causes for fever. So basically when you have fever because of heat stroke, when you are having diarrhea, then people tend to misuse over-the-counter antibiotic. I wish to underline this very fact that using indiscriminate use of antibiotic is not only harmful for your own health but also harmful for the community, because indiscriminate use of antibiotic has resulted in development of antibiotic resistance.
It brings us back to the main issue when you said that the prevention is better than cure.
Yeah.
And you said that we have to take measures especially for the people who are at the extreme ends of population, the children and the elderly. Could you please elaborate on that aspect?
Main brunt of heat stroke is actually borne by these two people. The reason is that the mechanism for the thermoregulation is not that well developed in case of children. They are still in the phase of development. And the buffer zone for dehydration is very less for children. So suppose a youngster who has suffered say 5 or 10 episodes of watery diarrhea may even manage even at home, but the younger one who has developed large, say 3 or 4 or 5 episodes of diarrhea will definitely have to be seen by the pediatrician. Same way among elderly, because of the buffer for the body system has less amount of buffer. So even if they develop lesser degree of heat stroke, they develop more symptoms like altered mentation, vomiting. These are more common among senior citizens. So this is how it goes.
A common myth or the perception in the rural areas, it is said that if you are having dehydration due to heat stroke or some other reason, the best way out is to have an intravenous therapy. How effective or how useful is it?
Well, intravenous therapy, IV fluids, they are the treatment only when it is required. As I have told that IV fluid is ideal when someone is having severe type of dehydration. And since dehydration is also common in case of heat stroke and related complication, so it is easier for you. It will be required when you are having severe one type of the dehydration. No IV fluid is as good as oral rehydration solution. So in the earlier phase, and that too when you have not developed the symptoms of vomiting, we always recommend our patient to take ORS even if the patient is being given IV fluids.
Which is of concern is the pregnant woman. What precautions must be taken if someone has a family who is in the family way?
In pregnancy, there is the dual care is required, the care of the pregnant lady itself and that too of the growing fetus. So based on this, as I have talked about, the degree of buffer is less for the people of pediatric age group, for senior citizen as well as for pregnant women also. Among pregnancy, a large number of drugs are not indicated. They are actually contraindicated as they can damage the growing fetus. So it is important for us to take care of pregnant ladies in this season by the various ways of prevention which we have already discussed.
That brings us to another issue which is being hotly debated in different circles, and that is the use of probiotics. Whether to use probiotics or not, how ethical or how unethical it is.
I will not say that it is unethical, but it is definitely not required. So people are bound to use it whenever they are having diarrhea. They tend to use probiotic. Whenever someone is having say upper respiratory tract infection or fever because of viral illness, they tend to take antibiotic which is available over the counter. So it is very important for all of us to understand that probiotic is not required as there is no alteration in the gut bacteria during the process of heat stroke. So probiotics are useful only when someone is having longer duration of antibiotic therapy and associated diarrhea.
We have received a question from one of our emails by one of our listeners where he wants to know that what should be the range of temperature in which he or she should be worried following heat stroke.
So 37.8 degrees Celsius is the normal body temperature. If someone is having fever, say in tune of 38 degrees Celsius, one need to, slightly worried. If it is more than 39 or 40 degrees Celsius, then the reason to worry is much more, and one has to take care of the doctor nearby. I would also like to re-say to you in terms of the Fahrenheit degree, because that is commonly used by the people. So 98.6 is the normal temperature. Till 100, you can manage yourself at home. If it is getting more than 103 degree Fahrenheit, then definitely you should go and meet nearby doctor.
Doctor, you have clarified many of the issues and the queries which have been coming across in the wake of heat stroke, and the people, they have to take a lot of precautions. Another concern is regarding the school-going children. The child comes from the school in the afternoon and then straight away jumps to the fridge or takes the ice cream or the cold water. What should be the normal way out?
The normal way out is let your body to come to the normal temperature. Have patience for 2, 3, 4 minutes, so that your own body temperature is slightly normalized as you have come to reach your home. Just be under the fan, number one. And number two, at the same time, let the chilled water from fridge is taken out and it also normalized to the near normal temperature. So this is the right way to avoid the heat-cold type of the shock that one gets.
Another issue which brings us to sort of understanding that we are living in an era of climate change, and many households we see the people switching on to the ACs at a temperature which is cool so that they can handle the heat. How cool is this coolness of the temperature in terms of the AC?
So if you talk about science, then 37.8 degrees Celsius is the normal temperature, and from 32 to 36 is the temperature in which we feel ourselves comfortable and we have maximum productivity. You must have experienced those days, like the days of spring, when you feel extremely good, you tend to read more, you tend to work better in your office. But since now AC air condition has got provision of decreasing the temperature up to 16, we tend to feel sort of more pleasant if it is reduced below 20. So I have seen in many houses people tend to take blanket and tend to decrease the temperature below 20 degrees Celsius. So this is not recommended. The reason is simple. The ideal temperature would be from 25 to, if you set the thermostat of AC from 25 to 30 degrees Celsius. If you have set it below 20 degrees Celsius, then you are more likely to face the consequences because of the widespread temperature variation. Number one, it is not good for your health because of the reason which I have mentioned. Apart from this, it consumes lot of electricity. So in this season we are seeing that there is larger demand of electricity, so there is a problem of a scarcity of electricity. And the third one, which is more important, that if we are using AC for longer duration, there are certain gases that are produced which are not good for our own atmosphere.
Well, listeners, that was Professor Dr. Piyush Ranjan from All India Institute of Medical Sciences, New Delhi, sharing his valuable insights on the current spate of heat wave or the stroke and how to prevent it. Well, doctor, thanks for sharing your valuable insights, and we look forward to have more such experiences with you in the times to come. Thanks for joining us.
Thank you very much, Atulji. It was an honor to share my views with all the listeners through you. Thank you very much.
You were listening to a discussion on precautionary measures to tackle the health effects of heat wave. The participants were Dr. Piyush Ranjan, Professor of Medicine at AIIMS, New Delhi, and Dr. Atul Kumar Tiwari from All India Radio. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on a mobile app, News on AIR. This program is also available on a YouTube channel, News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 9289094044.